Hello, everybody, and welcome to our third webinar of the year. Delighted to have Sultana Pasha from the Elizabeth line here today to talk to us about safeguarding. Just before we start, though, a couple of announcements via the branch. One is a central request or piece of information, which is that the Risk Excellence Awards, so tickets are now available. That's on the 18th of May. So anybody who would like a ticket to that, please do go through the usual channel to get one. And specifically for the London branch, we are currently working on 2 in-person events. Well, currently working on 3, but 2 in the foreseeable future. One ties up with the Safety and Health Expo in May, and on the 17th of May, we're looking at having some networking during that for anybody that's interested. More information on that will be through shortly. And the second one is we're actually looking at a more formal in-person event somewhere in London, probably June, July time. And again, that's been worked on by the committee, and more information on that will be through the website or will come out to you shortly. So today's discussion, we're going to have a look at safeguarding, and specifically, you will see that in looking at Sultana, who works on the Elizabeth line, that was opened on the 17th of May 2022, which adds around 10% more capacity to the Central London railway network. Built by Crossrail, as most people know, it's more than 100 kilometres long from Reading and Heathrow in the west through to Shenfield and Abbeywood in the east. The line stops at 40 web-accessible stations, 10 of them are new, with between Paddington and Whitechapel, 22 trains running an hour at peak times and 16 at quieter times. Perhaps much more relevant to today's discussion, is it expected to serve up to 200 million people each year. With that as our backdrop, I would like to introduce this evening's speaker. Sultana has worked in the rail industry for 7 years, with roles varying from community engagement to safeguarding and security. She's been recognised as a rising star in the transport industry by the Chartered Institute of Transport and Logistics, and has been shortlisted for various safety awards in the rail sector. In January this year, Sultana and her team were awarded the Outstanding Contribution to International Innovation by NTR Hong Kong, and for the introduction of a safe space by Romford Station. So that, I think, is a suitable introduction for you, Sultana, to speak to us a little bit more on the Elizabeth line and safeguarding. So I will hand over to you.
Thank you so much, Greg. Good evening, everyone. I'm Sultana. I'll be focusing on safeguarding, specifically in the rail sector, and what we are doing in this space. So if I just go into the next slide. So just to cover off what we'll be discussing in this presentation. So we'll be looking at principles of safeguarding, vulnerability, sexual harassment and wellbeing, suicide prevention, examples of creating a safe space, dealing with disclosure, and building confidence and competence amongst the workforce. There is a little bit of a trigger warning. We do cover some sensitive areas, so please do make sure you look after yourself, and if you need to step away from the screen, please do. I thought it'd be good to give some background into what safeguarding vulnerability is. I think a lot of people are quite familiar with the terms. However, it's quite good just to go over formal definitions. So safeguarding is a set of practices, policies and values protecting vulnerable people from a wide range of potential harms, which could impair their health and development. Now, this definition comes from the National Training Academy for Rail. And vulnerability refers to when a person is vulnerable if, as a result of the situation or circumstance, they are unable to take care of or protect themselves or others from harm or exploitation. And this definition comes from the British Transport Police. And it's also important to note that anyone can become vulnerable at any point in their lives. I wanted to make this presentation a little bit personal and give it that real human element. Of course, safeguarding is very important, whichever sector we work in and whichever area of the business we work in. For me personally, as a safeguarding manager for the Elizabeth line, I'm really passionate about creating a safe space, a safe railway for both customers and colleagues. So for me, that involves recognising that the railway is a force to bring communities together, and my approach to safeguarding is very much community engagement, making sure that we're working with the appropriate stakeholders and putting messages out into the community. I'm also working to change the image of the railway. So, you know, sometimes the railway is generally a safe space. Unfortunately, sometimes there are some things that may go wrong or may make individuals feel a little bit uncomfortable. And at the end of the day, I really working with stakeholders, particularly land sheriffs who are our private security team and the British Transport Police. We work to make sure everyone goes home safely every day. And you'll see that throughout the presentation. I've just popped a few images just so it's not very much word heavy. So this particular image is of a tweet from the British Transport Police with the dedicated team who patrol the Elizabeth line, just reassuring customers that they're out and about, supporting customers if they need it, and also providing reassurance to colleagues. My next slide, and I'd like to open up to the audience. What do you think can make someone feel, how can someone be made to feel vulnerable? I'll give you a few seconds, and if you could please pop your questions, your answers into the chat, please. And then I'll cover off just some of the areas as to how someone can be made to feel vulnerable.
So someone has put in alcohol, maybe alcohol abuse.
Yep, absolutely. Becoming intoxicated, yeah. Being unaware of your surroundings.
Another one here, mental health issues.
Absolutely. So your mental capacity, being aware of your surroundings and understanding what situation you're really in.
What about, I thought, maybe domestic violence or any kind of violence in the home?
Absolutely. And you'll see how abuse can affect your mental well-being and how it affects your presentation, how you come to work or school every day. Thank you for those suggestions. So if I just go into the slide, if it cooperates. So absolutely, all of the answers are absolutely correct, and there's an extensive list. However, I've just narrowed down a few of the factors which could make someone vulnerable. So your age, so being young amongst an older crowd, or absolutely being slightly elderly, and perhaps coming across a younger, a group of a youth, and that's a very stereotypical view. But of course, your age at any point can make you feel vulnerable. Being alone and traveling alone, that could make you feel vulnerable, especially if you're, I know there's this assumption and there's perspective that if you travel alone at night, you're more likely to be a victim of crime. And unfortunately, you know, crime can happen at any time, but there are mitigating factors and measures in place. Absolutely spot on with drugs and alcohol, how the effects of these elements. Gender identity, so you know, perhaps not fitting into the stereotypical boxes, if you like, of being male or female, or just going through an identity crisis. Your state of mind, so your mental well-being, having capacity to understand what you are going through and what you're experiencing. Language, so if you're abroad and you're trying to communicate with the local vendors there, perhaps not understanding what they're saying, and there's a real language barrier there. And perhaps being in the presence of an offender. So I know certainly we've had a bit of an issue with tissue beggars, where individuals, I mean, I suppose they mean no harm, but they are indeed part of an organised crime group, and they are exploited individuals. So sometimes individuals may feel pressured to give money to these tissue beggars. And I've also included an image of an operation, so a joint operation at one of our stations, where the Met Police and British Transport Police, apologies, in the railway we love acronyms, so BTP is British Transport Police, where they stopped someone and they were suspected of county lines. So quite a young gentleman who was seen found with a large amount of drugs and cash. I wanted to move on to the principles of safeguarding, and this is specifically refers to the Safeguarding a Rail scheme, which is accreditation by the Department for Transport, where train operating companies can enrol on. And this is really a tool to measure how rail operators, how they work to protect vulnerable people using the network. So what this looks like at the very top is making sure that organisations have buy-in from senior leadership and have that commitment there. And that commitment looks at championing the safeguarding strategy and making sure that each business area is held accountable with regards to safeguarding. So whether you're working with apprentices or working with neurodiverse individuals, making sure that these individuals are being looked after and you raise any concerns with the appropriate stakeholders. Then we look at safeguarding communications, so how we promote the well-being and welfare of vulnerable people, and this is through both internal and external communication. So internally, how do we promote safeguarding messages through our workforce? So for example, we have at MTR, Elizabeth Lyon, we have a weekly business update called Keeping Track. And on a periodic basis, I sit in the security and safeguarding team, a very modest sized security team, but we provide security and safeguarding updates on a periodic basis. And if there's any areas of concern, we make sure we highlight it in our communications. The next element looks at responding to vulnerability. So how do you effectively manage and mitigate against the risk of safeguarding incidents? So in my safeguarding role, I carry out frequent audits of our trespass and suicide prevention mitigations. Now this looks at signage. So we've recently introduced signage, anti-trespass signage in community languages, and that's reflective of the diverse communities that we serve. And we know that trespass is someone going onto the tracks or crossing the tracks as a form of shortcut, maybe down to education or cultural understanding. We also have platform end mitigations, and we're also looking at innovative CCTV to monitor and highlight any vulnerable behaviours. The next element looks at staff recruitment and their responsibility. So making sure that the HR team have a recruitment procedure in place to prevent unsuitable individuals coming into the business and engaging with vulnerable persons. And finally, I think which is perhaps one of the most important elements is training. So making sure that colleagues are receiving credible and relevant training so that they can manage vulnerable persons under difficult circumstances. And I'll go a little bit into that later on. So when we talk about safeguarding, there's a few elements which we'd like to promote. And it's really about changing the way we think from day-to-day life. So we really ask that individuals look beyond the obvious, they assess the risk and look out for other factors. So be aware of the risk, how vulnerable an individual may be, if they're being exploited, and certainly for the rail industry, identify patterns of travel. So if there's a young person who's in uniform, traveling during unusual hours of the day when they should be in school or college, picking that up. Are they using cash to pay for tickets, and are they traveling long distances? Be concerned, so be curious and ask questions about their safety and ask about the welfare, and just really check in if they're okay. Sometimes you might not get far, but I think what's important is if something doesn't feel like right, it probably isn't, and trust your instincts. If there is disclosure, make sure that you listen and take what they say seriously, and always treat them with respect and dignity, and reassure them by showing kindness and consideration, and offer to provide help and support if they request it, and certainly if there are any red flags. And finally, encourage them to seek support and report offences to either HR or to the police. And we go into the various stakeholders a little bit later on, but absolutely report it so there is a log of that interaction and that safeguarding incident. So in terms of recognising the signs and making interventions, some of the signs may be that an individual is incoherent or irrational in their thoughts and speech. They're not making much eye contact. So I think in communication, especially when you're dealing with a vulnerable person, maintain good eye contact, because their eyes will usually give away how they're feeling. So whether they're uncomfortable, whether they're upset, or whether there's something going on. If you're working with a colleague and you see that suddenly there's a change in appearance, that's also something to be concerned about. Ask them, are they okay? Likewise, someone may have a change in attitude and the way they present themselves. So are they upset? Do they seem to have an injury? Do they have any marks, any bruises? And sometimes if we're traveling out and about, or even at work, if we see that someone is wearing clothing not reflective of the weather, so whilst it's meant to be spring, it's still a little bit chilly. So if someone's perhaps wearing a vest and shorts with flip-flops or slippers, we know that's not quite right. And in order to make the interventions, we sort of assess the environment, assess the situation. So do they have friends nearby? Can you reunite them with their friends? Do they have all their belongings? Do they need medical attention? But before you ask for support from emergency services, ask for support from a colleague, just so that you have support in managing the individual if they seem a little bit unstable on their feet. And can you take the individual to a safe space? So stations are often seen as safe spaces. They're warm, and we have certain areas in the station where we can have private conversations with individuals. And of course, if there's any incidents of note or anything that concerns you, flag it with your designated safeguarding lead or with your welfare officer. So now we're moving on to sexual harassment. And the sexual harassment sort of is in line with the violence against women and girls. So in this space, across the rail sector, across transport, all staff are briefed on how to manage incidents of sexual harassment. So making sure our staff are sensitive and take away the information, and also where appropriate, report it to police so that it's investigated properly. And all incidents of sexual harassment are taken very seriously by the train operating company and by the British Transport Police. When speaking to the victim, also whether you're working in an office and you're a member or a colleague has revealed that they've been a victim of sexual harassment or domestic violence, provide reassurance that action will be taken with their consent. Familiarise yourself with the whistleblowing policy. Encourage colleagues to voice their concerns and be transparent in their conversations. And one of the things that we do at MT Elizabeth Line, we deliver customer awareness sessions. This encourages the bystander action and understanding how to manage these situations. So the campaign has really been developed by the Rail Delivery Group, Transport for London, the British Transport Police. So as the campaign has developed, there's pointers as to how bystanders can change the conversation, so intervene safely between the victim and the offender. And I'll go into a little bit, I'll go into the TFL campaign in the next slide. The image we have here is a walk and talk session we delivered in the Redbridge area. So this is where we teamed up with the British Transport Police and the Metropolitan Police, where we focused on women's safety. So we took a group of women from the local community and we walked down to the station, where we spoke about some of the safety measures we have in place. So we're very fortunate that all of our stations are manned or has member staff in place during all operational hours. We have great CCTV and we've got playback at the stations as well. And we've also got private security team who patrol our trains and our stations. So this is just a few examples of the Transport for London sexual harassment campaign. It's, as you can see, very bold, and we have some really good feedback on the campaign. And you can see these posters, perhaps if you live in London, you've seen these posters on your trains and stations. So it's really highlighting some of the behaviours relating to sexual harassment and what these behaviours actually mean. So you see at steering, how it explains that intrusive steering of a sexual nature is sexual harassment and is not tolerated, and how you can report it. So there's a few of these posters across our network, and this is a campaign that we strongly support. And the purpose of the campaign is to increase awareness and encourage reporting. So sexual harassment is, I think, speaking from experience and speaking to some of the victims through our customer awareness sessions, some individuals find it a little bit sensitive to talk about. So we're really encouraging people to come forward to talk about the experiences and reassure them that this will be taken seriously and police will investigate thoroughly. Moving on to well-being. So well-being, I think there's been a real focus on well-being since COVID. And I think for business, it's really important to have a trauma support document or trauma support approach. This is to really provide effective support to colleagues who have been affected by traumatic incidents, whether at home or in the workplace. And having a strong document with a strong approach, it manages the risks from individuals going off sick in the workplace, from mental ill health. And it also develops a good practice and reassures staff that the business actually cares, but also from a welfare perspective, making sure that our staff are really in the right frame of mind and that they feel supported. As part of the trauma support approach, making sure material are available through signposting to support services. So whether that's through notice boards, through the intranet, through business updates, making sure support is available. At MTR, we have something called Wellbeing Wednesdays. So our head of wellbeing will post a wellbeing fact or suggestion as to how you can manage your well-being, and that sort of varies from your mental, physical health and financial support. Saying that, it is important we get the balance right, making sure that we are providing signposting services, but also we're not flashing it everywhere. So to help us manage that, we actually follow Samaritans signage matrix. So if you go to our stations, at each platform end, you will find a Samaritans crisis sign, which basically is for anyone who may be experiencing crisis, and it provides the free call number to Samaritans. And those of you who don't know, Samaritans are a listening service. They're more of a listening service, and they won't provide any advice, but I know since we've had Samaritans on our stations through customer engagement sessions, we've had so many people going up to Samaritans saying, Samaritans have saved my life, or they've just out of nowhere, they've given them a big hug. So that's really reassuring, and we're really proud of our partnership with Samaritans. Post-incident, making sure support services are made available and making sure there's that engagement from the line managers. We know with the current crisis of cost of living crisis, a lot of people are struggling with finances. And I think everyone's got a story to tell, and not everyone will. I think a lot of people tend to bottle up their feelings. But one of the signs we can look out for is a change in appearance or their attitude. I think during lockdown, where we had lots of Zoom calls and team calls, it was really easy to hide behind the cameras. So we didn't really know what was going on behind the scenes. And just a very quick story I want to share with you. And a colleague actually shared this with me. So there was during team meetings a couple of months had gone on during COVID, and there was a point where the manager sort of encouraged individuals to put the cameras on. And there was one colleague in particular, when you saw him, you could see there was a real change in appearance. He looked a bit scruffy, unkempt, and it was quite shocking because this wasn't his normal appearance. So after the meeting, the manager had an informal conversation with the individual, and actually had a few conversations with the individual, and the individual revealed that they had really been struggling with lockdown, and they had turned to alcohol as a sort of comfort. And they were actually struggling with many aspects of finances, home life, and being the man of the household. So it just goes to show, just check in on your colleagues and ask them, are they really okay? Next, we move into suicide prevention. And I go a little bit into suicide prevention because it's a real important area and a real priority of mine as a safeguarding manager. Again, just focusing on the railway. So sometimes the railway is seen as a place of danger. However, we are working towards changing this image into a place of safety. And we work to protect the vulnerable as much as we can. So all colleagues within 3 months of joining the business, it's mandatory that all colleagues must complete the Samaritans Managing Suicidal Contacts training. Now this looks at managing difficult conversations and spotting the signs of someone experiencing crisis. We also follow this up by quarterly vulnerability briefings, and we know the railway is ever changing, and we have staff joining and leaving the business at various points. So making sure that all colleagues are up to date with briefings and they're comfortable with managing vulnerable people. Whilst we appreciate our colleagues are not social workers, unfortunately vulnerability does it is a natural presentation on the railway. Also, as I mentioned, safeguarding, my approach to safeguarding is community engagement. So making sure that we connect our railway with communities, providing an opportunity for members of the community and support services such as counselling services to come into the station and promote the services. So making sure that they're visible and providing support, making sure that individuals sometimes who may struggle to reach out for support, making sure that the mental health services and counselling services are made visible and are made approachable. One thing we've noticed in our railway, fortunately we've had a real dip in interventions. So life-saving interventions has really gone down. However, we have really had an increase in vulnerable persons. And when I talk about vulnerable persons, they're not necessarily suicidal. It's just people who have been affected by the cost of living crisis, breakdown in family relations, etc. So again, we're trying to change the image of the railway through various means, through adding colour to the stations, adding greenery, and making sure staff are available at each station. And there's also a picture of little me with a few of my railway colleagues from Samaritans and other train operating companies. So this was Samaritans earlier this month. They launched the Small Talk Saves Lives campaign, and this looks at how small talk can save lives, really. So if you see someone dazed out or looking onto the tracks, asking them a random question or asking them, where can I get coffee? And we did a bit of fundraising and awareness raising at Liverpool Street Station. But of course, there were roadshows across the country. Keeping in line with Samaritans, Samaritans provide listening tips, and it's specifically shush referred to as shush. And this is really helpful, I found, and I know a lot of colleagues who have completed the Samaritans training. They found it really useful in referring back to the listening tips when managing vulnerable people. So when someone provides a disclosure, show that you care. So making eye contact and making sure that all your focus is on this individual. Sometimes it may be a bit difficult to open up. So have patience with the individual and just let them open up when they're ready. However, we have found in pretty much, I would say about 80 to 90% of our interaction with vulnerable persons, it almost becomes that word vomit. Once you ask them, are they okay? It's almost like a relief, because individuals often want someone to listen to them and have that off the shoulder. Use open questions. So open questions are really useful in understanding, in getting the full picture of, instead of asking yes or no answers. So one of the open questions is, tell me more. And once the individual has finished with revealing their state of mind and what's bothering them, say it back to them. This demonstrates that you've understood and that you care about what they're saying. And finally, have courage. Don't be put off by a negative response. In some cases, you may find yourself not having the response that you would like to, and don't feel like you have to fill a silence. Like I said, have patience and let the individual open up when they're ready to. I want to share what I think is best practice, and it's something that we've worked on. So this is the Romford Innovation Hub, which was built together and delivered together by MTR Elizabeth Line, Network Rail and London Borough of Havering. So for background, Romford Station was recognised as #1 in the country for risk of suicide, and this is according to the Network Rail priority risk locations list. I'm pleased to say that has well gone off the list, and we've done a lot in this space to protect vulnerable passengers. Following this, conversations grew organically around 2018 to sort of explore what support was available to the community in the Romford area. We then started conversations with Network Rail and Havering Borough to identify a suitable location and secure funding to create a safe space. Like I said, 2018 is where we started the conversations. However, there were major delays due to COVID and delays to some of the station upgrade works, which meant that our hub wasn't up and running as soon as we would have liked it to. However, nonetheless, we persevered and we had regular discussions with our project managers and making sure we had regular updates and really pushing for the hub to be accessible, despite the station works ongoing. So this really demonstrated resilience, and we updated stakeholders in doing so. So stakeholders were really interested in developing this innovation hub. And the innovation hub, we work with street pastors who provide welfare to intoxicated and vulnerable persons. We work with triage teams who work out the hubs from Friday to Saturday evenings into the early hours of Sunday to treat intoxicated individuals and those who may be injured. This has also cut down the ambulance call out costs and timings, which has been fantastic. We also work with rough sleeping coordinators. So for a bit of background, historically Romford has unfortunately had a bit of issues with intoxication, rough sleeping and antisocial behaviour, hence the need for this safe space. And I'm really pleased to say that the hub was actually opened in October last year with the Havering Mayor in attendance, and since then we've really gone from strength to strength. And as Greg mentioned in the introduction, we were actually recognised by a parent company in Hong Kong for our innovation in this space. So we know that we're confident that this safe space, this innovation hub, has really supported the community in the Romford area. We've delivered various engagement sessions, which I'll go into next slide. So we identified the need of the safe space and absolutely the crisis of the national crisis of mental health and antisocial behaviour. We spoke about how we create a safe space and how we manage the incidents into the community before they have an effect on our railway operations. We spoke to stakeholders very much around, there was a real focus on stakeholder engagement, how we collectively seek solutions and build community cohesion, and where members could feel comfortable and confident to get the support that they needed. We also really wanted to provide a free space to be utilised by community interest initiatives. So far, since inception in October, we've hosted various community engagement sessions. The space has provided a free space for training sessions. It's been a base for joint borough operations, so multi-agency days of actions. We've delivered women's safety events, including walk and talk sessions. We've had community safety sessions, including providing support to refugees. And we've also had weekly police briefings for licensed businesses. Future sessions will include mental wellbeing workshops, which we're already seeing, delivered by Samaritans and talking therapies. So in terms of building a confident and competent workforce in the safeguarding space is very important, certainly in the railway, because our colleagues, our station colleagues are our eyes and ears, and they are the ambassadors for the business. They are the point of contact for customers, passengers passing through the station each day. For us, it's very important to have training and awareness, so making sure we keep our training records up to date and making sure that where there is mandatory training, colleagues are completing this within a set period. And also just looking at this from an outsider's perspective, making sure that businesses have regular evaluation to reinforce learning and continual professional growth through education. Making sure notice boards are updated with key information. So we also have electronic notice boards in our station mess rooms where staff have breaks. And we also support Samaritans campaigns, which we put on our customer information screens. We also work towards increasing information sharing between organisations. So where there is a safeguarding on the incident on the network, for example, a life-saving intervention, I will speak to the public health lead or the local mental health team, just to let them know of the vulnerable person's presentation. And that way, the community groups are aware of some of the challenges we face on the railway. And by having that conversation, having that communication process in place, we've actually built strong relationships with our local community groups and support services. And actually, we welcome them into our stations to promote the services, but also to help our passengers should they experience crisis or be going through a difficult time. And overall, we believe through these factors and through these measures, we think having good engagement by our colleagues will result in good safeguarding. And actually, we've seen the results. We've seen how the fantastic results by our stations teams. And I really want to focus on our revenue protection team. So our revenue protection team, they go out and about on stations, they check tickets and make sure people are paying for the tickets. But actually, they've been involved in lots of safeguarding incidents, ranging from reuniting lost children to their guardians, and also identifying an immigrant who illegally entered the country and had no means of social support. And so that just goes to show how our colleagues are really vigilant, they challenge situations, and they trust the instincts. So having good engagement with both staff and colleagues, we've seen that can result in good management of safeguarding incidents. Sorry, something's just gone a bit funny. The image we have in the bottom corner just here, this was during our what we called Hero of the Day Awards, where we recognise colleagues who have been involved in life-saving interventions. The awards are recognised by our managing director and our customer experience director. So we invite them into our head office. They receive a certificate of appreciation, and they also have lunch with our managing director. And I know our colleagues really appreciate this gesture. It's a small gesture, but it's a way of the business recognising the efforts and saying thank you to our colleagues for everything they do day in, day out. The next section looks at dealing with disclosures. So this sort of touches on the shush listening techniques, so I won't go too much into it, but one thing I sort of want to focus on is when you're dealing with disclosure, be aware of your non-verbal messaging. When there's a disclosure being made, try not to look shocked or repulsed. Don't make a joke or change the subject, and don't make judgment about what is being shared. That way, individuals may feel at ease and are more likely to open up to you. Remain neutral at all times. Once a disclosure has been made, offer reassurance that the individual has done the right thing to tell someone. And also, as much as we want to support the individuals, don't make promises to keep information secret. We say this because depending on the severity of the incident, information may need to be passed on to relevant stakeholders, either police or HR. When doing so, ask the person what they want to happen for the future. So let them decide what support they would like or how you can support them also. And as I mentioned before, make a record of conversation, either by popping an email to your HR or your line manager. This is a really important area of safeguarding, I would say. So I spoke about sharing information with our local stakeholders. However, when you are dealing with disclosure, make sure that concerns are shared privately and formally, only with relevant people. So this includes not discussing with other colleagues, perhaps other than your line manager, and discussing these private conversations out of work with family or friends. Seek if you're ever in doubt and you're not sure what step to take, seek advice. It's okay to ask for help, but ultimately, if something doesn't seem right, it probably isn't right. And of course, if you feel someone is in immediate danger of harm, contact emergency services. So I'm bringing the presentation to a close shortly. So we focused on a few areas of safeguarding. Of course, there's a plethora of strands of safeguarding, but what more can we do? So we've spoken about the safe space at Romford, and we're really looking at other locations where we can replicate this model because we know it works. As a railway, we are looking to change the environment. So we're reviewing our mitigations. So I spoke about innovative CCTV and making our stations brighter by creating station displays through greenery, through plants, and just making it a bit more of a pleasant journey. We can also delve a little deeper into community-based awareness and education. So how do community groups reach out? How do they understand some of the concerns in the community? And finally, look at cloud-based filters. So Ripple is a great cloud-based filter. This can be added onto your browser. And if you're in a public space, I know a lot of schools, colleges, and other institutions and some railway stations have actually adopted Ripple, which is a cloud-based form, as I mentioned. If someone searches harmful ways to hurt themselves, or if they search suicide-related activity, there's a message of concern which pops up, signposting the individual to support services. And that's really fantastic because it provides people an opportunity to get that support that they need and change their way of thinking. The image on the bottom here is just a group picture of our embedded mental health nurse. We're very fortunate to have an embedded mental health nurse, and she really helps us to engage with local authorities and mental health teams in understanding how some of the vulnerable people, some of the support plans for the vulnerable people on our networks, and what we can do to further support them. And the Brighter Journeys initiative is really around creating a brighter, more pleasant journey when travelling through the station. So to summarise, it's really important that we have a clear trauma support procedure, making sure that line managers deliver. This includes ensuring line managers deliver keep in touch days, making sure if there is a disclosure, making sure that we share it with relevant persons, ensuring that staff are well informed of company policies and support services. This is through notice boards, mandatory training, and regular briefings. And finally, I know some of the subjects we've spoken about today or I've discussed today can be triggering, so it's important that we look after ourselves. So I've just provided a few numbers, signposts to support services, whether you're concerned about a young person, yourself, or someone you know who may be struggling with the cost of living crisis. Absolutely refer them to the Citizens Advice Bureau, or and for yourself, talk to your GP or someone that you can trust. And that is the end of the presentation. Happy to take any questions that there may be.
Hello, brilliant. Thank you very much indeed, Sultana. That was a great presentation on what could be a difficult subject, and really good to see the amount of positive initiatives you've got in place, both on the Elizabeth line and broader on the network. Just a question maybe to start off for myself. What would you say is the most rewarding part of your role?
Thank you. I appreciate the presentation is quite heavy, so like I mentioned, if anyone feels affected by any of the subjects, please make sure you look after yourself. But to answer your question around what is the most, did you say rewarding part of my role?
Yeah.
I think I'm very much onto creating a difference and creating safe space. And whilst I may be the brains behind some of the initiatives, it is very much our frontline station colleagues who deal with these very difficult situations. So for me, I spoke about Romford and some of the issues and concerns I've had around this area. just the change in the station and the presentation of the vulnerable persons, that itself was a lot of work. But I'm really grateful for such a great great workforce, the supporting workforce, but also fantastic colleagues who actually dealing with some really difficult situations. So the fact that we've been able to save not just one life, but actually since our operations in 2015, our colleagues have saved the lives of over 500 individuals, which is just mind-blowing.
No, indeed. Thank you for that, Julie. I don't know if we've had any more questions in.
Yes, we have. So the first question is, where can we find out more information on the bystander campaign?
Sure. So you can go into TfL Transport for London website and type in sexual harassment. Everything should come up there.
Great, thank you. I'm not sure if you answered this one came in quite early, so I'm not sure if you answered this one. What wellbeing support services do you provide staff?
So for us internally, for myself, every time there is a traumatic incident, I will follow up with the colleague themselves. And I also work with either British Transport Police or the mental health teams, depending on the nature of the safeguarding incident. I'll provide an update from that stakeholder just to reassure our colleague that we've investigated thoroughly and it provides reassurance to the individual. We also have a great trauma support response in place provided by our HR team. Everything's done electronically, so line managers can actually go into personal records and keep note of any important communications. We also have a great employee assistance program, which I'm sure a majority of organisations have, and this provides support, confidential and free support to colleagues on various topics. We also have Samaritans who go out to our stations post-incident. We also have a railway chaplain who visits our stations and our offices and provides any support. If anyone wants to have a private conversation, they can absolutely do so. But I think at MTR we have a great company. I can't think of the word, but we have a really good culture. We have a great company culture. And I say this because our managing director will have his office door open. You can go up to him, have a chat with him. He'll go around. And this is for all our directors, really. So that I think that really reassures that our colleagues that the company cares and those at senior level really care about them. I hope that helps.
Yeah, yes, it does, and it's great to know that you're all looked after well whilst you're looking out for everyone else. So that's all the questions so far. Greg, do you have any more questions, or would you like to say a few closing words?
Oh, thank you. I had one more question just to finish up then. It was really with regards to the walk and talk initiatives you talked about. How many of those are you running currently, and is that something that you're looking to expand?
Absolutely. So it was actually a Metropolitan Police initiative. So we've run a few throughout we started them mid last year, specifically on the Elizabeth line, but they take place across the rail sector. And we are expanding them across the whole network, just encouraging people. And it's not just whilst we speak about women's safety, it's for anyone who may feel a bit vulnerable when they're walking or traveling in the local community.
Brilliant, thank you. So if there are no more questions, Julie, I will draw our session to a close. Once again, saying Sultana, thank you so much. That was, as I said, a fantastic presentation on what can be a very difficult subject, but one where there's a huge amount of positives in terms of what's being done, which is really great to see. So on behalf of the London branch and behalf of all our listeners today, thank you very much indeed for that, and thank you all as well for attending. I'm conscious of the time, it is just before 10 to 7, so wishing you all a very good evening, and we look forward to seeing you all virtually at the next webinar. Thank you all very much.
Thanks very much. Thank you. Bye-bye.
Thank you. Good night, everyone.